like to begin by acknowledging that the land upon which we gather today is Indigenous land. We also recognize that the traditional Blackfoot name of this place, where the Bow River meets the Elbow River, is Mohkinstsis, which we now call the city of Calgary. We would like to acknowledge that we are on the traditional land of the Blackfoot Confederacy, Siksika, Kainai, Piikani, as well as the Treaty 7 territory, which includes Tsuut'ina and Stoney Nakoda, which is comprised of the three bands of Chiniki, Bearspaw, and Wesley. Calgary is also home to the Métis people of Region 3. Well, good afternoon and welcome. My name is Matt Namura, Vice President with the Calgary Homeless Foundation, and I also have the pleasure of moderating today's discussion. It is with gratitude that we welcome all of you here today. Data That Makes a Difference is a Canadian homelessness data sharing webinar series that provides researchers with the opportunity to show how data is being used to drive the fight against homelessness. Through the webinar series, experts from across Canada and around the world have been able to share methodologies, findings, and innovations to data use and analysis to spark new ideas about how research and data can positively impact individuals experiencing homelessness. For several years, our Calgary Homeless Foundation and the University of Calgary School of Public Policy have partnered on research that seeks to improve the lives of people experiencing homelessness. Through this long-standing collaboration, there have been 4 previous annual conferences, as well as this webinar series, which launched in 2021. Now this year, we are so pleased to have Dr. Ron Kneebone as our guest speaker. Dr. Kneebone is a professor of economics and scientific director of social policy and health research in the School of Public Policy at the University of Calgary. His research examines government budgets and their financing, but more recently has focused on the economics of poverty reduction and homelessness. Professor Kneebone is co-author of 2 undergraduate textbooks in economics, a co-winner of the Doug Purvis Memorial Prize for the best published work in Canadian public policy, and a former associate editor of Canadian Public Policy, which is Canada's foremost journal examining economic and social policy. From 2016 to 19, he served on the board of directors of the Calgary Homeless Foundation, where he was chair of the Public Policy Committee. Recent publications include Patterns and Intensity of Use of Homeless Shelters in Toronto, Homeless Shelter Flows in Calgary and the Potential Impact of COVID-19, and How Do Youth Use Homeless Shelters, all with co-author Ali Jadizadeh. Ron's presentation today, Who to House in Housing First, explores the characteristics of clients who have experienced success in a large Housing First program implemented in Calgary, and the implications of those success rates for the justice and healthcare systems and reducing chronic homelessness. Please join me in welcoming Dr. Ron Kneebone.
Thanks, Matt. I'm going to start the slideshow in just a second, so you don't have to keep looking at me. Maybe I'll do that right now. And as I hope you can see, this is joint work with my colleague, Ali Jadizadeh. Ali and I, as Matt mentioned, we've been doing a lot of work together on issues to do with homelessness. We're asking a question in this presentation and in this research: who to house in Housing First? I'm going to run through slides for about 25 minutes, and that'll leave us lots of time for questions, comments, and maybe even attacks, whatever you want. But we'll see how it goes. This is, as Matt said, this is a joint project really with Homeless Foundation. As you're going to hear in just a few minutes, this is a very data intensive project. All of the data provided to us by the Calgary Homeless Foundation. So that makes this very much a joint effort for sure. And Ali, I'm sure Ali joins me in thanking the Homeless Foundation for the generosity in providing us with data and sharing that data with us. So the issue. Housing First programs have exploded in popularity as a tool for addressing homelessness. Governments have gone full bore in supporting and funding Housing First programs. They've done so largely on the basis of controlled experiments of relatively short duration and with a limited number of people carefully chosen to ensure fidelity to a specific model, what has become known as the pathways model of Housing First. The well-known at-home chez soi study is famous for providing evidence in support of the pathways model, and is the standard citation used to support Housing First initiatives. But the design of Housing First programs vary widely, with the result that many bear only a passing resemblance to the original model. Partly for that reason, the originators of the Housing First model now explicitly define their program as the Pathways model to distinguish it from many programs that are operating with less than full adherence to the guiding principles of that original model. The evidence to support or not support investments in Housing First programs ought to be based on how the programs actually operate in the real world and not how they operate in a controlled setting. The real world can be a hard place to operate a Housing First program, and maintain fidelity to a concept can be difficult to achieve. We feel that proper assessments need to also to evaluate the long-term success of these programs, however we define success, and we should do that over the long term. In this research, we evaluate a Housing First program in the wild and over many years. We measure success not over a 6-month time frame, as in the at-home chez soi study, but over a much longer time frame. So as I said earlier, this is a very data-intensive project. Our approach is data-intensive, requiring the linking of data sets with the use of unique personal identifiers. We use data showing how individuals move into and out of emergency shelters. We use data describing individuals' entry and exit into detox and outreach programs. And we rely on intake and exit interviews of people admitted to Housing First programs to learn more about their history with homelessness, both before entry into Housing First and after. These data sets are all administrative records that gather data on check-in and checkout dates and types of services delivered. These data include all single adult and family shelters, 3 detox programs, 10 outreach programs, and more. It's a very, very comprehensive data set. In total, we are able to assess the success and failure of 3,396 individuals who entered Housing First programs in Calgary over the period 2012 to 2017. So let's start by asking, what do these clients chosen for Housing First look like? This table describes the demographic characteristics of the people chosen for Housing First programs, and if they have one, their history of shelter use. We use cluster analysis to identify clients with a shelter history as having used shelters infrequently and for short periods, what we refer to as transitional clients, for somewhat longer periods, but still intermittently, what we refer to as episodic clients, and for very long periods, what we refer to as chronic users of shelters. For those without a shelter history, but admitted to Housing First, we know whether they came into the Housing First program from sleeping rough, from corrections, from addiction treatments facilities, etc. The number of clients is more heavily weighted, you'll see in the table, is more heavily weighted towards people who self-identify as male, something that is reflective of the broader population of people in Calgary experiencing homelessness. The percentage of participants who self-report their ethnicity is also consistent with the broader population of people experiencing homelessness in Calgary. Broadly speaking then, the demographic and shelter use characteristics of people chosen for the Housing First programs in Calgary closely match those of the broader population of people experiencing homelessness in Calgary over this period, an assessment that's based on what is reported in point-in-time counts. The percentages of Housing First clients with a shelter history who fall into the categories of transitional, episodic, and chronic is perhaps more heavily weighted towards those we classify as episodic and less heavily towards transitional clients than the broader population of shelter users, but the differences are not huge. Finally, the Housing First programs we evaluated varied by whether they were scattered site or place-based programs. The distinction is important because scattered site placements demand a considerable investment by the homeless serving sector to maintain good relationships with landlords in a city that has high rents and very low vacancy rates. So upon entry into a Housing First program, participants are interviewed and asked questions regarding their mental health status, the amount of healthcare utilizations they've had, and their interactions with police. Their experiences are self-reported, and although a case manager may be able to assist with the answers, they nonetheless rely on clients' memories about the interactions with the healthcare system and with police over the previous 12 months. This information is useful for observing how mental health and substance abuse issues and their absence might influence the rate of success in Housing First programs. We similarly use the self-reported interactions with police to understand how rates of success might vary by that number, by the number of those interactions. The data on these responses show that clients chosen for Housing First programs are quite vulnerable in the sense of dealing with some very difficult personal issues. The top table summarizes information obtained from questions that asked, quote, do you have an addiction/substance abuse issue? And, quote, have you recently, over the past 12 months, been released from a residential addictions facility? From the table, you'll see that 62% of clients participating in these Housing First programs self-reported mental health issues, while 71% self-reported addiction problems. Only 14% of clients reported neither type of issue, and 48% self-reported both mental health and addiction issues. The bottom table shows calculations stemming from answers to the questions, quote, how many times have you been hospitalized in the past 12 months? And how many times have you been in an emergency room in a hospital in the past 12 months? And finally, how many times have you had interactions with the police in the past 12 months? The table shows, or reports rather, the average number of visits or interactions per client. The large standard deviations indicate there's a wide range of experiences. It is important to note that police interactions are of all types, from minor issues to more serious. And because they are self-reported, they may include interactions with the Calgary Police Service, or with transit police, or even with bylaw officers. Our data allows us to define 5 outcomes for the Housing First clients. The first, called what we refer to as graduate to housing. This is determined by answers to a question asked in an exit interview, should a client leave a Housing First program? The questions asked are, why is the client leaving the program? And two, what is the client's destination? The majority of those we identify as graduating to housing report moving into a permanent form of housing. A smaller number report reuniting with family, and so reestablishing housing in that way. The second category is what we call in progress or in program. We use the term in progress as we indicate that, as we're trying to suggest that as time goes by, people may in fact graduate to permanent housing outside of the homeless serving sector. So we could say in program instead, and it'll give you the same meaning. So these are people who remain housed, but they're still in the Housing First program. The third category is return to homelessness. If after completing the exit survey, the client is observed in our data showing use of the shelter system, detox centers, homeless shelters, etc., for more than 10 days, then the client is recorded as having returned to homelessness. The category we call unknown, this you're put in this category if the client fails to appear in any of our data sets following admission to the Housing First program. So we don't find them in the homeless serving sector anywhere in the shelter data or any other data set that we have access to, and they have failed to complete the exit survey. So these people have disappeared and they may have left the city. We're unsure. They may have established housing outside of Calgary, but we don't know. So they're unknown. And finally, thankfully, only a few clients in our sample died while still in program. So what's success? What does success look like? So before showing you the results of our sorting of clients into these 5 categories, we should discuss how we evaluate these results. What does success look like? Only in that way can we identify a rate of success and offer some evaluation of whether or not these Housing First programs are actually working. So the success is defined as keeping someone in housing. This is achieved should someone remain in a Housing First program and so remain housed. These are the clients we categorize as being in progress, or if you like, in program. Another, and I think maybe greater success, is seeing clients transition to housing outside of the homeless serving sector altogether. This is achieved by clients who we identify as graduating to housing. So our measure of success is the sum of those two things. Total success is the sum of those who are in progress or in program, plus those who have graduated to housing outside of the homeless serving sector. To evaluate rates of success in Housing First programs, we need to omit those clients whose success or failure we cannot determine. So we're going to omit from the data set those who died in program. We omit those whose success at housing is unknown, the unknown category. And again, they may have moved out of the service area, so that's why we've lost track of them. They may have found housing elsewhere, or they may not. We don't know. And if we omit these 2 categories, then we're looking at 2,837 individuals that we can assess regarding their success or failure in the Housing First programs. So with all this in mind, how did the programs do? Before discussing success rates, I just want to use this graphic to emphasize to you that it's important to understand that program participants entering Housing First programs over the entire period from 2012 to 2017. Those clients who entered the Housing First programs in the early years were observed for a much longer period of time than those who entered in later years. Early entrants were able to be observed to see whether they returned to homelessness or whether they graduated to housing for many years. We could not observe later entrants for as long. So consider those who entered the Housing First program in fiscal year 2012. We can observe whether clients who entered Housing First programs in that year used shelters, detox centers, et cetera, for 7 years to the end of 2018. Sometime over the 7-year period, 45% of the clients admitted to Housing First programs in 2012 eventually returned to homelessness. 26% graduated to housing, and 10% remained in a Housing First program. Clients enrolled in Housing First programs in 2017 are able to be observed for just 2 years, in 2017 and 2018. Of those clients, 13% graduated to housing within those 2 years, and 46% were still in progress. 26% had returned to homelessness. We can expect the size of the red column for fiscal year 2017, the last column, to shrink, causing either the blue column, hopefully, or the gray column, hopefully not, to grow larger. Okay, so what do we calculate as the rates of success? The success rates of clients admitted into Housing First programs in 2012 is 44%. That is to say, of the clients whose outcomes we can fairly assess, they being the total of those who graduated to housing, remained in progress, or returned to homelessness, 44% either remained in program and so in housing or graduated to housing outside of the homeless serving sector. Similarly for the other years. We believe these success rates to be very impressive. This is especially so when we remember that over the period 2012 to 2018, an average of 48% of clients self-reported having both mental health issues and some substance abuse problems, and 71% reported having one or the other. This is a seriously vulnerable population. These success rates are comparable to those at the at-home Chez Soi study. In the last 6 months of that study, 62% of Housing First participants were housed all of the time, 22% some of the time, 16% none of the time. It's important to emphasize again that our evaluation of success and failure is assessed over a much longer time frame, and so we think might be considered more robust to unexpected events and constraints that occur outside of an experimental setting. These success rates are also impressive given that we are allowing many years for failure, a return to homelessness, to become a possibility. Finally, we think it's also impressive is the success clients had in moving into housing outside of the homeless serving sector, those we identify as having graduated to housing. Our next question is, what client characteristics are most likely to have contributed to these successes? We answer that question by showing Housing First outcomes by demographic and other characteristics. Here we aggregate over our whole sample period. This table reports rates of success by the demographic characteristics of Housing First clients. For example, 54% of clients who self-identified as male and for whom an outcome could be fairly assessed were successful. Females were slightly more successful at 59%. It's noteworthy that clients who self-identified as Indigenous clients realized lower rates of success. Success rates by age group, are not very dissimilar except for graduation to housing, where youth do very well and better than other demographic groups. We can similarly look at how success rates are related to histories of mental health and substance abuse problems. For clients without a history of mental health or substance abuse problems, the success rate at 68% is very high. Substance abuse hurts success by more than self-reported mental health issues. Clients with below average health system interactions and are no more successful than clients with above the average number of health system interactions. And again, I'm referring to the 12 months before they entered the program. Similarly for legal system interactions, one's 12-month history before entry into the program with police doesn't noticeably influence success rates. Although clients with fewer self-reported police interactions show greater success at graduating into housing outside of the homeless serving sector. Finally, scattered site and place-based programs show similar rates of success, although clients enrolled in scattered site programs are more successful in terms of graduating to housing outside of the homeless serving sector. Finally, again, the noticeably lower rate of success of clients with a shelter history, at only 44%, relative to those without such a history, at 70%, speaks to the possible debilitating effects of staying in a homeless shelter. So we titled our presentation in the form of a question, who to house and housing first? Different organizations would offer different answers to the question. Shelter operators benefit from success at housing chronic users of shelters because those clients fill 40% of shelter beds in Calgary. Their answer to the question of who to house and housing first would be chronic users of shelters. The health and justice systems, that is the provincial government, would answer the question by suggesting that frequent users of their systems be targeted. Finally, the choice also matters for funders. Here, a big player, at least since the release of the National Housing Strategy in 2017, is the federal government. They also have a vision of who to house and housing first, and have the dollars to push the preference on system operators. This carries a danger should the success rate of housing first programs be relatively low for those clients identified by the federal government. In that case, trying to simultaneously satisfy a requirement to target people with certain characteristics, experiencing chronic homelessness in this case, and reduce the number within a specific time frame or within a certain budget envelope can prove problematic for system operators. This is an interesting issue to consider because our results show that housing first programs in Calgary choose clients with high acuity, but not necessarily having an experience with homelessness that can be identified as chronic. We think it's worth exploring the idea that targeting people for housing first programs whose experience with homelessness is not chronic might be a better long-term strategy for reducing chronic homelessness. That is, if their success rates are high, and if that success in housing first prevents them from quote unquote graduating to chronic homelessness, then targeting people with short or episodic histories of homelessness may, in fact, be preferred candidates for who to house in housing first. In this regard, it's noteworthy that our results show that people with no or short experiences with shelters have very high rates of success in housing first programs. Cutting off the flow of people into chronic homelessness may be the most effective way of reducing the number of people experiencing homelessness in the longer term. This is research Ali and I are working towards currently. Finally, the slide you've been waiting for, the last word. Our evaluation of housing first, as it was implemented in Calgary over the period 2012 to 2018, shows they have achieved a very high rate of success. This is all the more impressive as we evaluate programs in the wild, rather than under controlled settings. And we allow many years to pass before determining whether clients will, in fact, remain housed rather than slipping back into homelessness. We know of no similar examination done elsewhere. If you have, please let us know. I'd appreciate knowing, but we haven't found any. Thank you very much for listening and happy to take questions.
Thank you very much, Dr. Kneebone, for the presentation. A lot of questions are coming through. So if you do have questions, please put them into the Q&A box, and I'll do my best to get Dr. Kneebone to answer. Dr. Kneebone, the first question we have here is following. Is housing first in its original intent still the preferred model of intervention for those experiencing homelessness?
That's a great question. It's really an interesting one. I guess one of the things that we stress in this work that we talked about today is that many, and maybe even most, housing first programs have drifted away from the original model as designed by and developed by Sam Sambaris, and is evaluated by the At-Home Chez Soi study, for example. My feeling is that the preferred model may very well vary by community. There's a lot of research showing now that the experience of homelessness, both as causes and how people respond to deal with those causes and how they respond to them, varies by the characteristics of the local community. Characteristics like rent affordability, the demographic characteristics, vacancy rates, etc. So that's why I think it's important to evaluate housing first programs in the wild, as we did in this study, and to be cognizant of the fact that what works in Calgary or Toronto may not work nearly so effectively in Medicine Hat or Antigonish. My feeling is that the preferred model may differ by community. And this suggests to me, and Ali and I allude to this in our study, we need to be careful about edicts coming from Ottawa saying that you should do this and you should do it in this way. I think communities need to be allowed the flexibility to design housing first programs that meet the specific needs and specific characteristics of their local community. So your question, I think, what's the preferred model? I don't think there is a preferred model. I suspect there's a preferred model that's unique to different communities.
Thank you, Ron. Next question is, what evolution within Housing First is needed to address growing complexities in communities across Canada?
Yeah, I mean, I'll just build on what I just said. And you're absolutely right, Matt. I mean, as you know very well, homelessness is a very complex problem, very complex. And it's complex in part because the problem responds to the characteristics of local communities again. And so I think as Housing First evolves, I think it needs to be aware of the fact that it needs to adapt to local conditions. So we show, for example, that persons who self-identified as Indigenous realize lower rates of success than other ethnic groups. That result, I think, should spur people to consider that there may be details in the Housing First program as instituted in Calgary that are somehow failing Indigenous clients. And I know that this is being looked at here in Calgary. But it's an example of how Housing First programs might find value in constantly measuring outcomes to see how improvements can be made and whether or not local conditions that are changing all the time may be impacting the success rate of a Housing First program. As the world changes, success of Housing First programs may rise or fall because the problem is complex and there's a lot of things feeding into that problem. So I suspect Housing First programs need to think about evolving in response to changing conditions, and that will require constant measurement and evaluation over time, which is admittedly quite a challenge.
Agreed. Just to continue the same thoughts, what would you say is the fundamental reason that the Housing First model has been so successful in Calgary? Is there anything unique about Housing First, or does Housing First model simply encourage higher levels of support for individuals experiencing homelessness?
Yeah, and I may not be the right person to be asking that. And I think the way to get at that would be to dig deeper than Ali and I have done in this study, because there's more than one Housing First program. There are Housing First programs designed specifically for youth, for adults, et cetera. And I think by looking at the different success rates of different Housing First programs, you can start to maybe learn about what it is that's working. And maybe all those programs, regardless of how different they are, maybe they're all giving the same success rates, in which case the questioner's answer might be that it's not Housing First, it's just providing lots of support. Or maybe it's something very specific about those specific programs. I think that's a great question, and it's a great area for someone, maybe me and Ali, to be digging into. But I think that's what you need to do to answer the question, is it Housing First or is it just more supports? But really, maybe a different answer to that question is I have a lot of faith in the general idea of Housing First, which is simply to help people first by giving them housing, and then let's work together with them to deal with their personal issues that are causing them to have fallen into homelessness in the first place. I'm an economist, and so I rely a lot on theory, and that theory makes a whole lot of sense to me, and I find it hard to question it.
Do you think that people who are transitional, episodic, will eventually graduate to the chronic category? In other words, is Housing First a chronic homelessness prevention tool? is often presented as a tool for chronic homelessness treatment since other programs have failed those people.
Yeah, I mean, we kind of touch upon that in our work here. In my later slides, I raised the question. You know, the federal government wants everybody to target those who are currently chronically homeless. But it may be a better strategy to target those who are at risk of becoming chronically homeless. And I think we need to be aware of that. And I think one of the values of the work Ali and I have done here is try to show that success rates may be higher for groups who are not chronic, at least not yet. So to really get a good answer to that question, who should we be targeting to end chronic homelessness in the long term? Is it the currently chronic or those who are at risk of chronic, suffering chronic homelessness? I think we need more study. Sorry to say that, but more thinking about, how quickly does one having experienced transitional or episodic homelessness, do one quote unquote graduate to chronic homelessness? There's been some study for that. There was a nice study to come out from ESDC, the folks at ESDC a little while ago. Ian Cooper is one of the authors, and I'm sorry I can't remember the others. So if they're listening, I apologize. But they show that the longer you are in a shelter, the more likely it is you're going to become a long-term resident of shelters, suggesting that people do in fact graduate to become chronically homeless. So I don't know the answer to the question, but I think it's a really important area to examine. What is the appropriate target for ending chronic homelessness? Is it the chronically homeless or those who are at risk of becoming chronically homeless? It may be the case that cutting off the flow into chronic homelessness is the best strategy rather than targeting those who are currently chronically homeless. Great question.
Can you comment on the tension between high success rates for lower acuity clients and a reduction in service use costs, mostly seen in the higher complex or acuity clients?
So I'm not sure. So I think the question is, should we be trading off, like maybe the effectiveness per dollar? Is that, I think maybe that's what's being asked. So I'll help you, Matt, because your problems are less complex than mine, and so it's cheaper to do it. If that's the question, I think it's essentially what I was talking about already. What's the appropriate person to be targeting? Well, it's a little bit different because I was talking about maybe targeting someone who's not currently chronic to stop them from becoming chronic. The questioner is asking, well, maybe I should target those who are cheaper to treat and have success with. I don't know. I'd have to think about that. My inclination is not to favor that approach, but I think it's worthwhile thinking about. Sorry, I don't have a really good answer.
The lowest rate of success appears to be those who have an episodic history of shelter use, about 24%. Any thoughts on why this might be the case?
No, but it's another great question. You guys are asking great questions, and I'm not giving any answers, but I'm recording all these, so these are all good research studies. No, I mean, I don't know. One can speculate that maybe they haven't been suffered homelessness for long enough to become for their problems to become more ingrained. I mean, we do know that the longer people are dealing with dealing with homelessness, their mental health and their substance abuse problems grow over time. And so again, it speaks to the possibility that we've got to get to people before they become chronic and before and you can imagine, maybe even going back to the previous question, you can imagine that the cost effectiveness of going early is all that much greater because I'm putting into housing people who, if I don't put into housing, are quickly going to start using the justice and health systems more intensely. So I got to get in there and save that money. So I'm speculating. I don't know. It's a great question. How would we get at it? I'll have to talk to Ali.
Ron, does the data have any information about the people returning to homelessness and what success in reconnecting with housing might look like?
Yeah, you'd really want to focus now, take another step after this, and now let's focus in on those who failed, those who went back into the shelter system, and find out more about them. What are their specific characteristics? I mean, we see a little bit of that, but I think what would be really effective, and you might want to use personal interviews to really get at this, to figure out what it is and what is the potential for getting them back into program and maybe answering their concerns. And in some sense, that's a very effective way of evaluating Housing First programs, is to talk to those who failed in those programs and ask them, why did it fail? Why did you end up back in shelter? And what could we maybe do to change the Housing First program to prevent that from happening, either to you if you came back in, or to people like you?
There's a couple of questions that run around the same thoughts here, so I'll kind of couple them in together. Decreased success rates seem to be correlated to addictions. Is there an idea or a solution to increase the Housing First success rates when addictions are a component?
Well, again, might be asking the wrong guy. I think what we really do need to answer that question is we need to talk to the people who run the Housing First programs and get very upfront and close with them and ask them specifically the specific details of the program. How are you addressing the needs of people who come into the program with substance abuse problems? And are there ways that we could change those? And, you know, from my point of view, is the point of view Ali and I take, we measure things, and we like lots of information so we can measure things. What we would ask is, maybe you could try to have different approaches to helping people with addiction problems, and seeing and measuring outcomes and seeing in that way which outcome is going to be more effective. Again, I'll allude, you can do that not only with addictions, but other things. We talked a little bit about the lower success rate of people who self-identified as Indigenous. Is there something about Housing First programs that are failing people with that cultural background? And that's a hugely important issue, something to look at closely.
I agree with that, Ron. I think part of the conversation that we do have with service providers, and when we take a look at programming specifically around addictions and mental health here in Calgary, it is around the staffing models. Do we have the appropriate supports? Are we funding the appropriate supports? Is the continuum of housing programs suitable for the demographics that we see today? Which goes back to the earlier question around, you know, Housing First, the original intent, no barrier, but that broader continuum as people's choices have to be at the forefront of where they are in their journey. And that is, you know, the challenge that we do have. You have a finite amount of funding and a finite amount of space to address the complexities that have been exasperated over the last 3 to 5 years.
Yeah.
Piggybacking on the tail end of what you just shared around Indigenous, next question is, I think the lower rate of success with Indigenous folks is something to really dig into further. Were there other characteristics besides Indigenous identity that were correlated, or any avenues for further research, or just bald speculation from yourself on closing this gap?
Yeah, to get at that, again, it's something Ali and I have talked about. So you can imagine, for the empirical researchers out there, you'll maybe understand why I'm saying more than others. You can imagine running a Probit or logic regression where we say that the success is a function of all these characteristics which we talked about today. And in that way, identify some joint probabilities of success. So someone who self-identifies as Indigenous and as female might have a higher success rate than someone who self-identifies as Indigenous background and male, and again, add another element who's young versus old. And add another element again, whether someone who has self-reported a mental health issue or addiction issue. So all of these characteristics that may be a combination of characteristics that have greater success than or failure than other combinations of characteristics. So that's how I would answer that question, which has lots of challenges to it, but that's how you would try to get at it. After controlling for all the other characteristics one has, what are the combination that are causing you the most problems? Again, a great question and a whole new research study.
To continue that thought, does your full analysis include looking at these factors when controlling for other factors? For example, looking at the effect of ethnicity with controlling for mental health and substance use issues.
Yeah, that's exactly right. So that's just building on what I just said. No, we didn't. So we're looking, these are more descriptive statistics. The success rate by these various characteristics are very descriptive. Our overall success rate for the programs is a success rate for a program that is where the clients have these have all these characteristics bundled together. And so to actually drill down and to identify what specific characteristics, what combination of characteristics, your history of police over the previous 12 months before entering the program, your experience with the healthcare system, your ethnicity, your age, your et cetera, what combination of all those lead to great success or failure? We haven't answered that, but that's a really good question to be answering as well.
The demographic data mentioned, seniors, youth, et cetera. Have you found anything related to people living with disabilities?
Good question. So I'm thinking the answer is no, and I'm trying to figure out why. I suspect that information wasn't available to us, but I'm not sure. So the answer is no, we didn't, but the answer might be because we didn't look. But one suspects a disability, and of course it will depend on the type and severity of the disability, is going to create just another layer of serious challenges that are going to make it difficult for you to reestablish housing. So I suspect the success rate is going to be lower for people with that characteristic, unless of course the Housing First program is specifically designed for people with that particular disability, which I suspect is not true, because that would involve very specific program, but maybe not.
This next question, I can help with this as well, Ron, as you talk about what went into it, and I got a little bit of insight of what the system here has moved itself into. But the question is, does the data being collected support examination of factors in success in the Housing First program for individuals in health, education, and employment?
Sorry, I'm not sure what's meant.
Does the data being collected support examination of factors in success in the Housing First programs for individuals? So would health or education or employment interventions lead to a higher degree of success?
Oh, yeah. I mean, well, the data we used in this wouldn't answer that, but no. But that would certainly be, and actually you will know better than me, Matt, throwing you under the bus. You know better than me the extent to which a Housing First program actually tries to help people with employment, beyond just establishing, or not just, but beyond establishing housing?
Well, that is just it. And as we have taken a look at the traditional way of looking at housing, key performance indicators, and moving into a space of understanding if we're helping people recover, what would be the domains of impact that we need to ensure that we are working with community on. And so as we move into next year, we are introducing new domains of impact, which will include quality of life and health, financial independence, and community integration. Because it is the belief that if we are working with community partners on their program design and models, how do we coalesce that learning of these interventions to build capacity within the system? So it's an excellent question, and it is the evolution for the Calgary Homeless Foundation as we move into next year with community partners.
Yeah. So establishing housing is just the first step.
That's right.
Yeah.
That's right. Okay, we got time for a couple more questions here, and I'm just going to find the next one here. Ron, do we know the average length of time that participants in progress before they graduate to housing or return to homelessness?
Not offhand, but that's something that we should be able to calculate from the data. But I don't know offhand. My guess is, and I'm basing my guess on the slide with the bars, the colored bars. Remember the last bar for 217? There were a lot of people in progress and relatively few who had graduated. And I suspect the reason for that is we haven't had enough time go by for those people in progress, in program, to have finally graduated to permanent housing outside the system. So my guess is it might take a year for that to happen. Because remember, the other bars had higher movements into graduated to housing. And so maybe it just takes an extra year for people to make that next step. But that's just a wild guess at this point.
From your perspective, Ron, do we have adequate housing first capacity?
That's a challenging question again, and I don't know if it's going to be something you can answer, because we see evidence of this. We see and the Homeless Foundation announces, oh, we've had great success. We've housed this many people, and it is success. It's great success, but we still see the number of chronic people. It's not going to zero, and part of the reason for that, of course, is Calgary is not an island, and there are people moving to Calgary all the time, and so what's the capacity for this? It's hard to know, and it's hard to understand what Calgary's capacity should be, because I don't think even that's relevant. What should be is the capacity for Calgary and area, where for want of a better word, the catchment area is much wider than Calgary, because people move to Calgary to where they, for many reasons, and they end up being homeless, and they end up using the Housing First program. But in some ways, the success of the Housing First program may very well attract people here and to use the program even more. And there's nothing wrong with that. If they're coming here because they are searching for help, there's certainly nothing wrong with that. But it does raise the question, well, what should be the capacity of the Housing First program in Calgary? And I don't think it's got a really solid answer to it.
Ron, this will be our last question. How does the research account for people who have been housed multiple times through different Housing First programs?
So long as you're not, so if you come back, you may slip into homelessness and then come back into a program. Then we put you back into the in progress category. So That's another interesting question. I hope someone's writing all this down, Matt. These are great questions. Another interesting question is what percentage of our clients actually did that cycle, move out and then come back versus those who just stuck it through right to the end and found success or failure. It should be in the data. We should be able to figure that out. It's an interesting question.
Well, Ron, thank you so much for an incredible presentation. The work that the School of Public Policy produces is so influential in our ongoing fight against homelessness. So thank you so much for your time and your wisdom today. And a big thank you to all of you for taking the time to join us as well. We appreciate it. As we move forward, this will be available on our Data That Makes a Difference websites. So please feel free to view the presentation there and of course past events. And we do look forward to seeing you in person, hopefully when we do resume conferences, and we look forward to that. So thank you all and have a wonderful day.